Okay, so this is a slide that I used to present many times per year. This class is focused on how to personalize medical device, or better, how to promote mass personalization of medical devices. We will discover what does it mean, but before understanding how to mass personalize a medical device, we need to understand how to fabricate an object, and then understand how to fabricate an object in a way that allows us to modify in a very fast way the final shape without modifying the whole process of fabrication. So when you want to create an object, physical object, you have three main opportunities. The first, and probably one of the oldest, is the formative technique. So you have a mold, pour material inside, let it solidify in a way or another, put the object outside from the mold. Another way, always belonging to the formative concept, is to take something, bend, or just distort, apply a distortion, and then you have a different shape. The first one, subtractive technology, is what you probably know as a milling machine or a turning machine. So you have a part, and then you start to eliminate what you don't like or what you don't need better. The central one is additive manufacturing. So starting from material, it will be assembled layer by layer into a 3D object. Now, this concept is known as 3D printing. We are engineers, we prefer to say additive manufacturing. 3D printing is for layman people. When you talk with journalists, you can say 3D printing. When you talk with professionals, prefer to say additive manufacturing, because 3D printing is a specific technology in additive manufacturing. So, let me check. Okay. Additive manufacturing is a process for creating a 3D object starting from a digital model. So this is the first key point of additive manufacturing. You need to have a digital model, so a model on your computer that can have the shape that you like with very few constraints respect to the other technologies. And the other key point is that the material is laid down layer by layer. So, digital model, any shape, layer by layer. I was speaking about 3D printing. Why? Because 3D printing is a very popular term. Also in journals such as Men's Health or GQ. Okay? So, but do you know when 3D printing was born? How many years ago? 5 years ago? 10 years ago? 20 years ago? 20 years ago? You know? 40 years ago? A bit less? 35. The first patent was submitted around 83, 84. And the first patent was about stereolithography, a specific technology of additive manufacturing. How many of you know this shape? Just one? This is called hype cycle. Hype cycle is a diagram that explains the feeling that we have for the technology. Every year there is a company called Gartner who proposes this graph for a lot of different technologies. In this case, this is the graph for additive manufacturing, where you can find many, many, many technologies. Let me check. For example, here you have, so how it works. So at the beginning, technology is just for few people. There is a lot of expectation, but just in a restricted number of people. Then there is the hype. So technology is known by the big public. There is a lot of expectation that this technology can change the world. After a while, in which people discover that, okay, it's not so easy to 3D print everything, then there is this valley, say, of disillusion. Then companies understand the real constraints of the technology, and then it will go to the application in an industrial scenario. For example, think about this. This is the consumer 3D printing. If you take the hype cycle of 2014, 2015, the consumer 3D printing was in this position. There was an hype in this technology. If you have a 3D printer at home, people came to your place to see the 3D printer. And then, after a while, people understood that it's not so easy to 3D print the object. So, if you have a 3D printer downstairs, not so many of you stayed in front of the machine, looking in the moment while it is printing. If you made the same situation, if you reconstruct the same situation 3 years ago, many of you, included me, used to spend hours just watching the 3D printer printing. What can you 3D print? How many material, how many type of material? You can 3D print, you can additive manufacturing, practically every type of material. You can 3D print ceramic, plastics, metal, living organism. Do you know what this picture represents? These are 3D printed medical devices produced for the space station. Do you know that we have a 3D printer on the space station? So these were designed on Earth, produced in the space. Why? Perfect. It's faster to transport information rather than object. One of the first applications of additive manufacturing, one of the first ideas was to 3D print the space station on the moon using local material. So, or for example, can you recognize, can you understand what this application is? This one? Yes. So, reconstructing lost objects. Probably you know that we can 3D printing houses. You know that we can 3D print cars. You can 3D print food. According to you, is it important to 3D print food or not, from medical point of view? Can you figure out a possible medical reason for 3D printing food? Eating disorder, so you can give a different shape to a food that a person probably mentally do not want to eat. Or even worse, people that cannot swallow. But they would like to have at least the idea that they are eating something good or something nice. You can 3D print engines. This is a GE application. You can 3D print drilling guides for dental application. You can 3D print organ or scaffold. This is a drill guide that was 3D printed more than 10 years ago. So, this is another application of 3D printing. I don't know how many of you are aware of Invisalign orthodontic device. Is it 3D printed? How many say yes? This is a personalized medical device. Is it 3D printed? How many are for yes? 1, 2, 3, 4, 5, 6. Guys, I am not able to focus you after the second line, so up your hands if you say yes. Okay. This is not a 3D printed object. But this was built based on thermoforming on a 3D printed mold. Okay? Now, up to now we were just joking. This is the same story that I used to tell to everyone where I got to speak about 3D printing. The main reason of this introduction, long introduction, 20 minutes, was to make you understand that you have many fabrication technologies. 3D printing is a particular fabrication technology, or better, additive manufacturing is a particular way of producing objects that allow you to have any shape that you like, that starts from a virtual model, digital model. It's called also digital manufacturing sometimes. That it is useful every time that you need to personalize an object, but you can personalize not only the object, but also the tool that you use to produce the object. That you can print the material that you like with very few constraints. You're able to print from an engine to a cast to an organ. But sometimes you can recognize that there are fastest way to obtain that specific object. So 3D printing is not the solution to all the problems that you can face during your career. Now, after this introduction, without any formal description, we will go through 25 minutes of information. First of all, as you understood from the classes of yesterday, we have ISO standards also for 3D printing. They try to classify additive manufacturing technologies in different categories. Why? Because in this way it's faster for people to know what they are selling and to know what you are buying. There are many different classifications. This is one classification. They try to classify according to different ideas, according to the technology that they use to produce an object, according to the initial shape of the material that you are going to fabricate, according to the type of energy which is given to the material to obtain the final shape. We will have the slide on the website, so just listen. So sometimes we will follow this technology, sometimes not. It's not important. The idea is that anytime that you figure out that there is the opportunity to give the shape in a computer-controlled way to a particular object, to a particular material, that probably is a way to 3D print that material. If you invent a particular chemical reaction in which you have material A and then you will add material B and then you have gelation of the material, that is probably a way to create a 3D printer. So, first technology, fused deposition modeling. This is the most known up to now additive manufacturing technology. You have a video. I'm not going to spend a lot of time on this technology because you will have a briefly, you have a filament which will be extruded through a tiny nozzle and laid down in different shapes. You have spools of filament of different materials that will pass through a tiny nozzle where it is heated around 200 degrees, and immediately it will solidify, let's say, into the final object. The material is not melt, but it is heated to pass through the nozzle with a limited stress inside the material. Which material you can print? Mainly, the most known one is called the ABS. Another famous material is PLA. But now you can 3D print PLA loaded with metal, loaded with wood, loaded with any other type of material. You can 3D print nylon, you can 3D print PCL, you can 3D print using the FDM machine polystyrene, you can 3D print polycarbonate, you can 3D print ULTEM, you can 3D print many technological plastics. It is one of the most exploited technology. These two objects were 3D printed using the print that we have downstairs. It is built with layers that can go from 100 micron up to 500, 600 microns. It depends on the application that you want to have. The layers are usually visible. If you want to make them not visible, you have to work on your object at the end. This is printed using FDM, ABS with FDM. You can have multiple nozzles, and usually when a 3D print has multiple nozzles, let's say 2, the second one is used to print the support material, which is a material that will help you to maintain the parts of your object in position during the printing process. And then you have to eliminate at the end of the printing process. Or just use it to print in different colors. That is the cone of VLC. I don't know how many of you use the things. The first technology instead that was invented for 3D printing is called the stereolithography. How many of you knows the photopolymerization process? 1, 2, 3. Do you know what photopolymerization process is? It is the way you can build this object. Photopolymerization is a chemical reaction which is triggered by light. Photons around the UV radiation are able to trigger the polymerization process. So from a liquid resins, you can obtain a solid resin. This is not something that you usually see in the street. You have specific type of resins with specific photoinitiator, so substances that absorb the light and produce chemical species that triggers the polymerization of the resins that you have. Probably in your mouth you have photopolymerized resins. When you go to the dentist and you stay with the open mouth for seconds with the blue light in your mouth, in that moment your dentist is promoting a chemical reaction to acidify the resins that just make the cover on the hole that you have on the tooth. Okay? How it works? You have a resin bath, and then you solidify the resin following a specific pattern. After that, you solidify the first layer. Usually, you can have another layer on it, and then solidify, and then another layer of liquid resin, and then solidify. This is the classical methodology, which is the one that we can see in this video. There are some problems. For example, you have just a single sink, so just a single type of material, at least in the basic version. At the end of the process, the object is wet. You have to remove the unsolidified resin. Can you have the object with the scaffold around it? The object, the final object, has the shape of the blue one, or the transparent one, which is passing for you. But now you can see also that in this case you have this structure all around it. This is the subtotal material that you have to remove at the end of the process manually. And this is made with the same material of this one. Okay? So usually with stereolithography you use a single material. Layer after layer after layer after layer, you print a 3D object. Can you see something not so nice in this configuration? You have this. Sorry? Loss of strength? Is not the worst error, according to me, to this configuration. Can you see another? You have always the manual work, also here. You have a lot of material for 3D printing. Okay, you're right, but not because they are building the scaffold, but because you need always to have the wall material, so the sink, completely filled of your material. Otherwise, you're not able to print. Okay? So people were thinking about, are there other opportunities, other configuration? Yes, there are other configuration. You can let the light pass through the bottom in this way. Yeah. This is the configuration that we have in the machine that we saw in the video. People thought, in this way you have always to have the sink full of material. People thought, but if I can illuminate from the bottom, so I'll put here a sort of contact lens that let the light pass. So I can solidify just this layer. So probably I need a few material and move my object toward up in the meantime that it is printing. So just switching the basic idea that you have to put the light from the top, you invented the new 3D printer. This is, with this configuration, we printed the object that I had in my hands. It was printed in this position. So first this one, and then the scaffold, and then this was the last part. Can you see some problem in this configuration? You're right. So resins are very viscous. Viscosity is the property of liquid substances to flow. Okay? A low viscous material is a material that needs just a bit force to flow. A very viscous material is a material that needs a lot of pressure to flow. Okay? This is in a very informal way. So you believe that the flow goes in the correct position just because you move a bit up. Consider that the layers of stereolithography can go down to 25 microns. You know how big is this number, or how small is 25 microns? Probably less. A living cell, human cell, can be perhaps also bigger than 25 microns in diameter. So a layer which is tiny than a single cell. So the liquid will never go there. So what they were thinking, okay, I move up and then down, up and down, up and down. How many times? All the times that you need to print. So if you make layers of 25 microns, you have in 100 microns 4 times, in 1 millimeter 40 times, in 1 centimeter 400 times. If you think that to go up and down you need around 50 seconds, because you have to go up, squeeze the resin, and then down. Rest, and then illuminate. This makes you thinking that 3D printing, in stereolithography and 3D printing in general is not a very fast process, especially in this configuration. To 3D print that object, the one that we have here, it took around 2.5 hours. Consider that other technologies, such as injection molding, will produce, I don't know, 1,000 parts in 1 minute, or even a higher number, okay? So this is a very slow process. People studying the material science invented a new concept. It's called continuous liquid interface. Instead of putting like a normal glass here, they just put a contact lens that let the oxygen pass through the window. Oxygen is not something that resins like. It makes an obstacle for photopolymerization. And so you have always liquid material here. And so you can start the photopolymerization a bit far from the window. And so you are having a very large distance. It flows faster. In this way, you can continuously print and moving up without doing up and down, up and down. This is called clip technology. I'll show you this technology just to make you understand that research and change of paradigm can completely modify the way you produce the object. This is 7 times accelerated, but this is how it works. Illumination from the bottom, and then move up the material. Very few amount of material on the resin tank, because you don't need to have the whole sink completely filled. And in this way, you can very fast obtain an object. Oops. I don't know how much time we have. We have 1 hour, another hour to understand what we can 3D print and which are the limits of 3D printing. So I don't want just to make a list of technologies. I want you to make understand which is the process to go for 3D printing. So I'll be very fast because it's not the topic of this class. Another technology for 3D printing are the technologies based on inkjet printing. Inkjet is a technology by which you can make very tiny drops. Tiny drops means picoliters of volume. Means that the radius of the drop is around 40, 50 microns. So very, very tiny nozzle. And what you can print? You can print photopolymer, and then you can solidify it. You can print wax that make you a solid model made of many drops. You can print glue onto powder material. And if you think about the opportunity to print glue onto powder material and then put another layer and then glue and then put another layer, you obtain what is called 3D printing. That is the original technology called 3D printing. This is very interesting technology. The first one that I introduced you called Polyjet. So 3D printing of liquid photopolymer, and just after the photopolymerization, the printing process, you have the photopolymerization. Apart from the opportunity to have a sterolithography without having a sink, so less waste of material. Can you see the revolution in this way of producing object, this specific way? Sorry? No, you need material anyway to support. And now I'll show you why you need always support material. If you want to print a picture, are you printing in black and white? You print with different colors. How many? Many. You can print with 4 colors. So RGB, let's say, it's not RGB, but I understand you. And then you have the black one. You can go and possibly up to 96 different cartridges in experimental setup. But what is very, very important is that you can mix 2 different inks before printing. And so you can have a graded material, a digital material that you decide just 1 second, let's say, before producing the drop. You mix ink A plus ink B, and then you can modulate color, optical properties, so from transparent to less transparent. But what is very important, you can modulate mechanical properties from soft to hard. 2 different materials mixed in a different way. Don't break it. This is what is called digital printing in the real sense of the term. You are not thinking now into layers, but you are thinking about in voxel. What is a voxel? Is a pixel in 3D. So, voxel. Each small volume is created digitally in that specific moment. And you can modulate the color, you can modulate the mechanical properties, you can modulate transparency, you can modulate conductivity, thermal conductivity, you can modulate electric conductivity, you can modulate whatever you want. Oh, sorry. I will skip, I'll go very fast to this technology because we are going to have another talk specific on laser sintering, which is the production of solid parts by melting grains of material which are laid down as a powder material into a cabin. You can melt polymer, you can melt metal, you can melt grains of powder with an inside a core of metal, and so on. There are many other technologies for 3D printing, so I don't want to go through all of them. This is, for example, something new which is invented by HP 1 year ago, a couple of years ago, that allowed to produce this type of object that you need always to clean and so on. But there are many of them. But I don't want to make a list. It's no sense. The important is to understand the concept. You can print whatever you want, from polymers to gels to metals to ceramic to biological material. Each technology is specific for the material. You cannot print metal with all the technologies. You cannot print polymers with all the technologies. But you cannot print resins with all the technologies. But according to what you have to print, there is a preferred technology which have a specific accuracy, a specific repeatability, and a specific resolution. What is accuracy? What is repeatability? What is resolution? If you take a data sheet of a specific 3D printing machine, probably you are not able to understand what resolution is, or what accuracy is, or what repeatability is. So let's make an example. If I say I need a picture, or I have a screen with very high resolution. Think about the retina display. Pixels are so small that you are not able to see them. So for you it's clear that it has a high resolution. But if I say that this object has a higher resolution with respect to this one, what does it mean for you? You can distinguish the layer. But what about the resolution that you have on the plane? Because you are producing layer by layer. So you have to understand that you have a specific resolution in terms of layer thickness, but you have another specific resolution in terms of what you are able to identify as a printable spot into the plane. What about accuracy? What accuracy is, according to you? Exactly. So between the FDM and stereolithography, which is the most accurate 3D printing technology? Who is for FDM? Who is for stereolithography? Fortunately, FDM is more accurate than stereolithography. If you think that you don't have just to think about the object immediately out of the 3D printing machine, but think that that plastic is going to change over time. It has a very limited stability. So the resolution of FDM is higher in terms that the smallest dimension that you can print with FDM has a higher value, 200 micron. You cannot print object, tiny wall of 200 micron. But what you print is exactly what you have in your digital file. And it lasts for a longer time respect to stereolithography. But you can tell me, no, but I just need the part immediately after printing. So the correct answer is that there is no rule for saying this technology is better than this technology, is better than this technology. Because it depends on the object that you want to print. Because if you have to print very small wall, very tall, probably it depends on the shape. You can print them using FDM, and you cannot print them using stereolithography, or the opposite. So, when you are looking for a specific application, the best way is to try. Because additive manufacturing involves many times chemical reaction or physical reaction, so it's quite hard to have the certainty that you will get the object, especially if it is a very complex object with very small parts, usually in the limit of resolution of the technology itself. Okay? I'm speaking about very complex parts. For instead, very general, very big parts, don't worry. Simulation can help you. So this is a couple of tables according to the layer thickness and accuracy that you have. So what you have to understand that additive manufacturing is not the solution to all the problems that you have. It's a partial resolution. You have to be aware of some problem. So very smooth object cannot be obtained easily. Probably it's quite hard for you to 3D print a lens and use it as it came out from the printer, but you need to have other other steps of working on it. Probably tolerances are not so accurate as in CNC machining. So you cannot go down up to a few microns. Surface finishing and aspects are not as expected. These are different, so you already saw them. Downstairs we have two printers. They cost around 1,000 euro each. But professional printers used to cost 30,000, up to 100 or 200,000 euros. So the cost of the system is an important cost. The cost of the material is an important cost. The process is slow, so you cannot produce thousands of parts per day, but you can think about you can produce at maximum thousands of parts per month. And usually you need very skilled operators. So there are some problems with 3D printing. And at the end, consider that there are many other opportunities to fabricate an object. So don't just be stuck on additive manufacturing. I have 10 minutes to show you how to 3D print an object. So, the first step is have a digital model. A model which is on your computer. You can get it from the web, you can design it, you can get it from an instrument that will allow you to obtain the external shape of your object, or if you have tomographic data starting from CT scan or MRI scan, you can have a segmentation process that will describe the object that you want to print. After this class, you have a class on scanning, a workshop on scanning, or you have a workshop on segmentation and image analysis. After you have the external shape and also sometimes the internal shape of the object that you want to print, you have to pass it through the software that you use to print. This is the most known format. It's called STL, which means sterolithography, because it was the first object. Now people try to change the acronym like solid tessellation language. It's just a list of vertex that describe triangles. It's a very common format. Now there are many others. But consider that there are also other opportunities. You can describe a volume by its voxels. This is voxel-based representation. In this way, you are just representing the volume with the surface around the volume, a closed surface around the volume. In this way, you are describing drop by drop the volume. Probably describing the model with millions of voxels is not so low cost, let's say, for your computer, but you know exactly the property of each volume. This is the most tricky point to explain today, but some of you told me you don't need, for a specific technology, the support material. These are all the examples that allow you to understand why you need support material. You need to sustain overhangs. So part of the object that are not so stable during the printing process. Or, perhaps more important, the parts that are separated from the base during the printing process. Let's make a quick example. For my Spanish friends. So you have to print a person in this position. Okay? Now you start to print this layer, and then this layer, and then this layer, and then this layer. And then you try to print this layer. These parts are completely separated from the body, which is growing. So this means that they don't know where to stay. So you need to create supports and check that your model is printable before starting the printing process. Otherwise, your fingers will go away. I was thinking about this like 2 nights. So support can depend, of course, on the position of the object. For example, I cannot find the object. It can depend how it is placed, and placing the object onto the deposition plate gives you different mechanical properties because layers, so object is laid down in different paths. So according to you, I don't know if I gave you the blue handle. This is the handle of the kitchen. So do you have with you? Who has? Guys, the blue object. Okay, yes. Just this one, and the one with the scaffold. Can I? Yes. So this is the handle of, let's say, a door. According to you, it is better to print in this position, so the layers are in the bottom figure, or in this position? This one or this one? Why? Exactly. So, but because I don't have, so I prefer that it looks more beautiful, I decided to print in this position. But if you put in this position, you need support material. And it's not so nice. And you need to finish it. And so I don't want to make a post-process. So the initial shape was with not a flat surface, and then I changed the design to print in this position. Support material can also depend on technology. And after that, you decide how to place the object in the printer, then you can decide the pattern according to the technology that you have. You can have projection, one layer at a time, completely. It can be done just with the light. You can do a raster process. So you can explore the space and deposit drop just where you need, or having a raster, a vector path, as in FDM. Remember that you're printing a solid object, so you don't have just the external shape, but also the internal part. So you can design not only the internal, so the support, but also the internal and external shape, parameters of printing. You can decide to print it as a solid object, so completely full of material, or you can have an internal structure. Then you have to print how you prefer. And after that, you have to finish it. Now, because we don't have a lot of time, I'm here the whole week. So if you have we have time if you have for 1 or 2 questions. Otherwise, we will skip to the Andres part. And then we have a guest from EOS company who will show us some case studies about mass personalization. Okay? So if you have any do you have any questions? Ben. So we can skip to the other part. Andres?
Good morning.